Hi there, welcome to Explain This, a podcast where we try to explain complex things in simpler ways for people of all ages. I'm your host Jin Kim, and today we'll learn all about sepsis, which is a topic suggestion from my lovely colleague Jane. Thank you, Jane, and keep those suggestions coming because I love hearing about what people want explanations for. So, without further ado, let's talk about what sepsis is, how it kills, and what we do in the hospital to fight against it. I can guarantee that at some point in your life, every single one of you has had at least one infection. Infectious diseases are everywhere. It's germ city out there. Whether it's something as mild as a boil around an ingrown hair, a sniffle, or even one bad day of traveler's diarrhea, your body is constantly defending you against a host of microorganisms waiting to get inside you. Sometimes, your body's defenses are overwhelmed or fooled into letting some germs sink their teeth into you, causing an infection. Although your body has natural defenses against infections, sometimes it's just not enough and infections can kill you. If you look back on history, infectious diseases have been one of the top causes of death for humanity, whether you're young or old. This includes all the nasty plagues such as smallpox, the bubonic plague, and cholera, but also other widespread diseases such as tuberculosis, syphilis, meningococcus, and wound infections. And the vast majority of these deaths are caused by a phenomenon known as sepsis. Even now, in the day of modern medicine and antibiotics, sepsis affects up to 50 million people per year, causing 11 million deaths a year. That's one death every 2.8 seconds. And don't worry, I'm not going to do that Bono clap. Sepsis is the cause of 1/5 of all deaths in the world. In some countries, that ratio is high as half of all deaths. So yeah, sepsis is a big deal. So what is sepsis? Why is it deadly? And how is it different from terms like blood poisoning? Let's explain sepsis to you as if you were a child. The world is full of teeny tiny living things that we can't see with just our eyes. If you've ever heard of viruses, bacteria, and fungi, then you know what I'm talking about. We call these things microorganisms, or microbes, which literally means teeny tiny living things. Now, these microbes aren't what you would call evil, they're just trying to survive and live long enough to make babies. And turns out, our bodies make perfect homes for microbes. We're warm and moist and full of nutrients. I mean, imagine if you came across a gigantic castle made out of pancakes. Wouldn't you want to nuzzle into that warm, soft pile and just eat your way through? That's basically all an infection is. A microbe, or a big group of microbes, tucking into your body and setting up a cozy home. Maybe eating bits of you as well. This by itself sounds pretty bad, right? If the microbes eat important cells, such as your heart muscle, or bones, or kidneys, you'd get pretty sick, maybe even die. But turns out, the worst part of having an infection is not necessarily the infection itself, but how our body responds to the infection and fights it. Just like any good castle, whether it's made out of pancakes or bricks, your body has defenses. It has soldiers that can search out, capture, and kill germs. It has automatic homing missiles called antibodies that destroy germs that the body already recognizes. But most importantly, it is an alarm system called inflammation. This is like pressing the fire alarm. Sirens start blaring, sprinklers go spraying, and the heat gets turned up, both figuratively and literally. This is why you get fevers and feel miserable when you have the flu, or why cuts get swollen and red and hot. Inflammation sounds the alarms that the soldiers need to get their butts over here fast to kill the infection. But sometimes, for one reason or another, the battle can get too frantic. If the alarm system gets overloaded, the soldiers might go into a frenzy and start damaging the castle itself. And not just the part where the infection is, but the whole body. For example, if bacteria get into the bloodstream, they sometimes can leave toxic breadcrumbs that make the body freak out. This causes alarms to go off all over your body, but especially in your blood vessels, which will make the blood pressure drop, and as we learned before, you need the pressure to deliver blood to all your important organs such as the brain and the heart. So if the infection keeps growing and the alarm response keeps making soldiers go crazier, you'll eventually die. This is what's called sepsis, when the immune system over-responds to an infection, causing injury to the rest of the body and all the organs in it. So, wash your hands, get your vaccines, and take the medicine the doctor gives you, no matter how disgusting it is. They'll save your life. Welcome back. Now, the immune system is a wonderfully complex and intricate concept that will take many episodes to explain. So, today, we're going to focus just on what happens in sepsis, rather than explaining the entirety of innate and adaptive immune systems. If you're interested in how the immune system works, go back and listen to episode 24 on vaccines, or episode 10 on fevers, and I'm sure there'll be more coming in the future. Anyway, back to sepsis. To give you the technical definition, sepsis is defined by the 2016 Society of Critical Care Medicine and European Society of Intensive Care Medicine Task Force as a life-threatening organ dysfunction caused by a dysregulated host response to an infection. Okay, once again, but in English please, Jen. Sepsis is basically when the body overreacts to an infection, which causes damage to itself, potentially killing you. Which seems strange, right? You probably thought that when people die of pneumonia or COVID or meningococcus, it's because the infection is destroying the vital organs. And while that is technically true, the biggest killer of infections is actually sepsis, as in your body's response to the infection is what's killing you. Which sounds even stranger, because isn't the immune system supposed to help keep us alive? Why would it do us dirty like that? Well, it's not really the immune system's fault, so go easy on it. And you can see why the topic of sepsis is so interesting. Before we get into what happens in sepsis, we have to first understand what the body's normal response to an infection is, and why it can go haywire and turn into sepsis. When a microbe such as bacteria enters the body, let's call it Jerry, the body doesn't like it, because Jerry's a jerk and is planning on squatting. So, when roving patrol cells called macrophages, a type of white blood cell, detects Jerry's presence, it immediately proceeds to attack Jerry, eating him whole and breaking him apart into bits. Nice. When this happens, the macrophage doesn't just chill there thinking it had a good lunch. It's smarter than that. It knows that if it found one Jerry, there must be millions of other Jerrys scampering around, multiplying and planning on causing more havoc. So, it sounds the alarm by spraying chemicals around the area. It's as if the macrophage is sounding a car horn while shooting flares into the sky, screaming, "Oi, oi, need some help over here!" These chemicals trigger a very important process called inflammation. As the word suggests, inflammation is like setting the area on fire. Kind of like the macrophage is lighting a beacon to signal a napalm strike on its location. Inflammation is very useful because it triggers a whole bunch of things to happen, all of which helps the body fight infection. Firstly, it causes nearby blood vessels to dilate to bring more blood to the area. This is because fighting infection takes a lot of energy, so you want to make sure that the troops will have plenty of oxygen and food to fight on. Plus, blood is where the immune system deploys more white blood cells into, so it's like setting up the logistics for the war effort. This increased blood flow is why inflamed areas feel hot and look red. Secondly, it causes the blood vessels to become leakier. This includes proteins leaking into the surrounding area, which brings fluid with it through osmosis. This is why you see swelling, but also get pain and inflammation. The fluid has additional benefits, like creating blisters or padding for injured areas, or making joints sore so that you don't keep moving that sprained ankle and injuring it more. But the other reason the leakiness helps is the third factor, reinforcements. The inflammatory signals alert millions of other white blood cells, such as neutrophils, to roll out along the blood vessels to the side of danger. The cells literally roll along the walls of the vessels until they smell the inflammatory signals and seep through the vessel wall to get to the action. Now, the white blood cells are ready to fight. They go around chomping up as many bacteria, as they can find, mopping up the debris and cleaning up the area. And most of the time, that does the trick. Infection destroyed, no more sickness. Great! This is called acute inflammation, and it's actually a pretty effective way to fight infections. Do note that inflammation isn't just a response to infection. It also happens when there's any kind of injury, such as physical wounds, burns, toxins such as alcohol and cigarette smoke, and even stress and other immune reactions such as allergic reactions. And we call this acute inflammation because there's a whole other process called chronic inflammation, which we're not going to get into today. Anyway, that's the normal response to an infection. Flame it up, burn the infection down. But as we keep alluding to, sometimes acute inflammation isn't where it ends. And now, we're finally ready to talk about sepsis. You know the saying, don't play with fire because you'll get burned? Well, inflammation is kind of like that. Super useful in the right amount, but unchecked, it can cause a lot of destruction. In some infections, the body doesn't just stop with localized acute inflammation where the infection started. The inflammation can spread like wildfire. Why? Well, there's actually a lot of reasons. The biggest reason is the microbes themselves. For example, they might contain specific toxins that can trigger widespread inflammation in the body that goes out of control. There's a group of bacteria called gram-negative bacteria, such as E. coli and meningococcus, that contain a compound called lipopolysaccharide, or LPS for short, in the capsule that coats them. Turns out, this LPS is super triggering for the immune system. Like, even a tiny amount in the bloodstream makes the immune system flip out and fire up all the alarms. When LPS is detected in the bloodstream, the immune system starts mounting an immune response throughout the blood. This is bad because this means that inflammation can spread rapidly throughout the body without a specific area to focus on, like burning down a whole forest to kill one rat. There are many other processes that can trigger this kind of widespread inflammation in the blood vessels, such as the inflammatory signals produced by macrophages spilling into the blood and causing what's called a cytokine storm, or when too many defense mechanisms are triggered, such as the complement activation. But the end result is similar: inflammation in the blood vessels. Remember how in acute inflammation, the blood vessels dilate and get leaky? This is useful when it's bringing more blood to just one area, like a part of the lung or one ankle. But imagine it happening everywhere in the body. This means that not only are you leaking fluid into all over your body, resulting in less volume of blood circulating through the body, but the blood pressure also drops because the blood vessels are dilated. This is because pressure is inversely proportionate to the diameter of the tube. The wider the tube, the lower the pressure, and vice versa. This is why it's easier to suck milkshake up a thick straw instead of a thin one, because there's less resistance. Furthermore, all of this inflammation is actually not good for your normal cells. In any inflammation, some of your own cells are damaged or die as collateral damage, much like any battle. In your blood vessels, the specifically worrying part is the lining of the vessels, called the endothelial layer, becoming damaged. Because this makes the vessels even more dilated and leaky, further dropping your blood pressure. If you've listened to our episode on vital signs, then you know what that means. You need a normal blood pressure to pump blood effectively to all of your organs and cells, to provide oxygen and nutrients while carrying away toxins and carbon dioxide. The lower the blood pressure, the less you're able to supply these vital organs, which eventually results in starving, suffocating cells. This is what sepsis actually is: malignant intravascular inflammation. We call it malignant because it's uncontrolled, unregulated, and self-sustaining because it keeps damaging more of the endothelium, the inner lining of blood vessels. It's intravascular as it happens within blood vessels. And lastly, the inflammation is an exaggerated version of the normal inflammatory response to infection. As the sepsis rages on, the body rapidly spirals down towards becoming critically unwell. To compensate for the failing blood pressure, your heart starts to beat faster. To provide more oxygen to the cells, you start to breathe faster. Your skin becomes warm and flushed because of all the blood vessels being dilated. But eventually, when your blood pressure drops more and more, your skin becomes cool and mottled. It might even show small red spots and bruises because of widespread small blood vessel damage. You'll also be burning up with a fever as your immune system raises your body temperature in the hopes that it might kill the microbes off. Shivering and rigors are related to this. It's not because you're cold, but because your body is trying to get itself even hotter. All of the inflammatory cytokines floating around your body also makes you feel sick. Like you just want to lie down and do nothing and feeling miserable and sorry for yourself. This sick behavior is an evolutionary adaptation for you to conserve energy to use it to fight infections. If untreated, your vital organs start to lose function. Your kidneys stop producing urine because it needs constant blood flow to filter the blood and make urine. You breathe even faster because your blood is becoming more and more acidic from the lactate produced by your oxygen-starved cells, as if you're sprinting. You get confused and drowsy as the brain is not receiving enough blood. Eventually, your organs will shut down one by one in a process called multi-organ failure, which is just as fun as it sounds. And of course, like all of us eventually, it ends with death. Woo! Ain't that a positive note to pause for a break? When we come back, we'll talk about the more fun part. What can we actually do about sepsis? How do we look for it and treat it? We'll see you soon. Welcome back. So, by now, you know that sepsis is a serious illness where your immune system overreacts to an infection and, in the process, may or may not kill you. Which means, as doctors, we take it pretty seriously. Sepsis can be caused by pretty much any infection. The common culprits are bacteria causing pneumonia such as streptococcus pneumonia and urinary tract infections such as E. coli, but essentially any infection can lead to sepsis. This is why sepsis can be a bit hard to discover. It can present in a variety of ways. It might start with a simple viral infection like influenza, a diarrheal illness like cholera, or even fungal and parasite infections such as yeast and malaria. This means that we also need to look for a variety of symptoms, signs, and test results that might indicate that a patient has not only an infection, but sepsis as well. Thanks to modern medicine, there are lots of ways we can hunt for infections. The best way is to listen to the patient. Do they have any symptoms of an infection, like cough, vomiting, diarrhea, trouble peeing, severe headaches, and most importantly, a fever? The second is to examine the patient. Do they have signs pointing to an infection, like crackling sounds in their chest, tenderness over the kidneys, or a suspicious rash? Along with these specific signs and symptoms of infections, we look for general signs of sepsis. We've already talked about fevers, the body's natural defense system to try kill microbes by making it too hot for them to handle the heat. But sometimes when people are septic, especially elderly patients, they can go cold as well, or hypothermic. This is called cold sepsis, and it throws off less experienced doctors and nurses. We've also mentioned that sepsis causes widespread blood vessel inflammation, which makes blood pressure drop because all the water is leaking out and the vessels are dilated. This low blood pressure also manifests as fast heart rate, as the heart tries to compensate, and a higher breathing rate because the body needs more oxygen and the blood is becoming more acidic. You might also see signs that the organs aren't getting enough blood supply, such as shortness of breath, inability to make urine, mottled and cool skin, confusion, and drowsiness. All in all, there are a lot of things we look for, even if it looks like the doctor is just giving you a quick look over. There's a thing in medicine called the end of bettergram, where sick patients just look sick with their fast breathing, exhaustion, and pallor. Anyway, we can also do specific tests as well. Blood tests might show signs of inflammation, such as raised white blood cell counts, or a high CRP, a blood marker of inflammation. We might see the body's organs starting to suffer, such as kidney or liver blood tests starting to become deranged. There's one very important blood test called a lactate, where we measure the amount of lactic acid in the bloodstream. If you're a gym bunny, you've probably heard of this chemical. It's the product of the cells in your body undergoing anaerobic respiration, as in they're trying to make energy without oxygen. It's a sign that your cells are not thriving, and they're really struggling to make ends meet, because it's not getting enough blood supply. A raised lactate is a pretty damning sign that something is going on in the body, and the organs aren't too happy. Another weird thing that can happen in sepsis is that your blood can't clot too well. If you have a lot of inflammation happening throughout your bloodstream, it damages the endothelial lining of the vessels, triggering a lot of teeny tiny blood clots. Eventually, your body uses up all of its chemicals needed to make blood clots, so, ironically, it can't clot anymore. This can lead to bleeding throughout the body, which is not a good thing. We call this DIC, or disseminated intravascular coagulation, and we can look for it on blood tests. Whew, all of this makes it clear why med school takes so long to finish, huh? But we're not done yet. We can test different bodily fluids such as urine, pus, sputum, nasopharyngeal mucus, and even the fluid surrounding your spinal cord to directly look for microbes or evidence of them. If you've done a rat test in the past 4 years, then you know what I'm talking about. That's just testing the fluid that sits in your nasopharynx or the space behind your nose. Lastly, we can look for visible signs of infection in your body with the clever use of radiological scans. X-rays, ultrasounds, CT scans, and MRIs let us see if there are any obvious inflammatory changes around organs, blocks of infection, and abscesses, which might point us to where the primary infection is hiding. Using all of this information, the medical team can diagnose a patient with what kind of infection they have, whether they have sepsis, and how unwell they are. But all the tests in the world won't help us if we don't know what we're looking for. This is why there's been a huge push in the last 20 to 30 years for awareness around sepsis. Some of the signs of sepsis can be quite insidious and non-specific, which means doctors or nurses might not realize a patient is septic until they suddenly decompensate and are at death's door. For example, young healthy people can hold off infections and sepsis for a reasonable time. So even if they're harboring a nasty infection and their immune system is starting to struggle and tip into sepsis, their blood pressure might look absolutely fine. But they'll still have subtle signs such as their heart rate being a bit fast. If you ignore this and say, oh, that's because they're anxious, you might have missed the opportunity to organize tests and start treatments, and the patient might end up very sick or even die. It gets even worse for vulnerable people who might not present with all the typical signs of sepsis. Newborn babies, elderly people, and people with chronic conditions or illnesses and medications that lower their immune function might all respond differently to infection compared to a healthy person in their 20s, say. Similarly, Indigenous people and people of color are often disadvantaged in healthcare due to systemic racism, worse health literacy, and different symptom reporting and sign presentations, such as certain rashes being harder to spot on darker skins, not to mention language barriers. So there's a lot of reasons why sepsis goes undiagnosed, even when we have the tools to look for them. Now this is more for the medical audience, but to do our part in spreading awareness of sepsis and looking out for it, let's quickly talk about the current way to assess for sepsis, QSOFA. If you're not medically trained, don't worry, we'll get right back to the sexy stuff in a couple of minutes. In the past, we used to talk about meeting SIRS criteria to diagnose sepsis. This included things like raised white cells, fever, or hypothermia, tachycardia, and tachypnea, which may all suggest that sepsis was kicking in, especially if you had evidence for infection. But we've moved on from SIRS now because it's too non-specific. Instead, we use another, maybe a bit too non-specific tool called QSOFA, or Quick Sequential Organ Failure Assessment Score. Basically, if you have 2 or more of increased rest rate at 22 or above, altered level of consciousness of GCS 14 or below, or low blood pressure of systolic BP 90 or below, then you should immediately be concerned for potential sepsis. Again, a lot of things make people confused, hypotensive, and tachypneic, but it's a way for healthcare professionals to rapidly assess for potential sepsis, so keep that in your minds. And for the interested experts, QSOFA is a truncated form of a more detailed tool called the SOFA score, which looks at a few more factors such as platelet count, PaO2 to FiO2 ratio, and other complicated things like that, which help predict the mortality risk of sepsis patients. Whew, for the jargon out of the way, let's go back to layman's land, where not every word is polysyllabic. Now that we've talked about how to look for sepsis, it's time to talk about how to treat it. So, let's say you've identified a person with sepsis, confused, febrile, heart racing, breath chugging, and lactated climbing. What you gonna do now? As complicated as the management of sepsis is, we can actually simplify it to just 2 important points: supportive care and source control. We've already found out just how deadly sepsis is, and how almost assuredly you will die without treatment. So we need to do some damage control and keep the body alive while we fight the sepsis. In emergency medicine, we often talk about the ABCs. Always be closing. That's sales. ABC in medicine stands for airway, breathing, circulation. This is because that's the order of things that can kill you the quickest. We've discussed this one in one of our earlier episodes on CPR, so go back and have a listen if you want to discover just how amateur this podcast was at the start. Anyway, the same ABCs apply to sepsis. First, we need to make sure that the person can breathe well, because a body fighting off an infection and undergoing a lot of inflammation needs truckloads of oxygen. This is because A, the blood pressure is low and the cells aren't getting enough oxygen, so you need to maximize the amount of oxygen in the blood to counteract this, and B, because your heart is racing and the body is burning up, so the cells are working overtime to keep up, and if you don't pay them with oxygen, they're all going to go on strike and you'll die. There's also C, your blood becomes acidic as the lactic acid level climbs and your kidneys are shutting down, which means your body needs to breathe fast and pump out carbon dioxide to rebalance the pH. And D, because the infection might be directly affecting your ability to breathe and bring in oxygen, such as when you have pneumonia or COVID-19. The patient might also be so sick that they're getting drowsy and slipping into a coma, or their muscles might be starting to tire out from breathing so rapidly for so long. This means that in cases of severe sepsis, we might need to put the patient in a medically induced coma and put a breathing tube into their airway, so that we can take over their breathing mechanically with a ventilator. Even if they're not this unwell, we want to at least give them some extra oxygen by slapping on some nasal prongs or an oxygen mask. Second, we need to deal with the circulation issue. We keep coming back to the concept that sepsis is predominantly an issue with the blood vessels, the massive widespread inflammation causing the blood vessels to dilate and leak, dropping the blood pressure. So we use the golden rule of what goes down must come up, and we want to raise the blood pressure. There are two main ways we can do this in medicine. We can illustrate this with a broken garden hose. Imagine that your hose is leaking water, so all you get is a piddling weak stream coming out. What can you do? The first and most simple way is shove more water through it. Jack up the tap and pour more water through that hose. Then even if you lose some of the water through the leak, you'll end up with a much higher water pressure coming out the end. In medicine, we do this with intravenous fluids. Basically, we can pour in salty water that has been balanced to match the saltiness of blood, to avoid the water shifting too much in and out of cells through osmosis. We call these kinds of fluids crystalloids, the most common of which is normal saline, or literal salt water. If you inject the fluid directly into the veins, you boost the volume of blood that can go around, which boosts the blood pressure. This is a very cheap and easy way to raise the blood pressure, but unfortunately, we run into limits. Typically, you can pour in about 3 to 5 liters of fluids into a person, but eventually, these fluids will still leak out of the blood vessels into the rest of the body. The worst place fluid can leak into is the lungs, because the airways can get waterlogged, reducing the amount of gas exchange they can do. And we just spent the previous bit talking about how we need to give more oxygen. So if you're not winning with IV fluids, you need to use the second trick up your sleeve, vasopressors. Going back to our garden hose example, if you were to squeeze the garden hose, you'll notice that the water sprays out faster and harder. This is because just as dilating a tube reduces the pressure inside due to a drop in resistance, the opposite holds true, and constricting, or shrinking the inside of a tube, increases the pressure. So, we can give medicines such as adrenaline, noradrenaline, and metaraminol, which force the blood vessels to constrict to raise the blood pressure. These medicines are called vasopressors, and they're a key part of making sure the body has enough blood pressure to keep the organs happy and alive while you're treating the person's sepsis, without flooding their lungs. Fluids and vasopressors are two of the most important facets of supportive care in sepsis. With good intravascular access, early fluids, and adequate vasopressors, you'll notice the lactate level drop down rapidly, the kidneys will produce more urine, and the patient will wake up more and look better. There's some other things like monitoring the urine output, ensuring the patient gets good nutrition, and giving cooling cares to drop the fever, but for the most part, it's all about that blood pressure. The second arm of the pincer movement approach to tackling sepsis is source control. As in, we already know that sepsis is the body over-responding to an infection, so if we don't treat the infection, all the fluids and vasopressors won't stop the body reacting, right? Like if someone's allergic to peanuts and they're just chowing down on peanut butter, you'd slap that jar out of their hands. So we want to find out what kind of infection we're dealing with and where it's hiding, so we can kill it dead. One test that is very handy is a blood test called a blood culture, where we take a blood sample and let it sit in a petri dish, just to see what bacteria grows from it. Because if the bacteria has made it into the bloodstream, then we should be able to test for it. Now, it's time for a tangent. Remember how sometimes people think sepsis is the medical word for blood poisoning? Well, this is a bit of a misnomer because blood poisoning is an old term for what we now call bacteremia, which means that there's bacteria in the blood. Remember that germ theory and the concept of microbes is relatively new. It was only the mid-19th century that we started having conclusive proof that microbes even existed, let alone caused disease. Before that, people thought diseases were transmitted by bad air called miasma. Even so, because infections often cause tissue and cell damage, ancient physicians still knew that some kind of rotting or poisonous process was occurring when a person had a bad infection. This is why they used terms like blood rot and why sepsis is the Greek word for decay or decomposition, coined by the OG doctor Hippocrates himself in 4th century BC. Even in the 19th century, when doctors were coming to terms with accepting that microorganisms were causing infectious disease, they thought sepsis was caused by toxins released by microbes in the bloodstream, hence blood poisoning. And funnily enough, this was technically true. A lot of bacteria produce chemicals that our immune system absolutely hate the sight of, so it can cause a huge immune response, which, as we now know, is called sepsis. The most common one is lipopolysaccharide, or LPS, that we described at the start of the episode. This simple chemical in the capsule of gram-negative bacteria is so triggering for the immune system that even a teeny tiny amount injected into the bloodstream can make you incredibly sick. When LPS was discovered, it was also called endotoxin, because scientists wanted to differentiate it from the kinds of toxins that bacteria would secrete and spray around them called exotoxins. So in a technical way, you are kind of suffering blood poisoning when you have sepsis due to some bacteria. But this isn't inclusive enough, so we don't really use this term anymore. Instead, we call the illness sepsis, and call the phenomenon of having microbes in your bloodstream septicemia, as in you have sepsis in your blood. You can be more specific depending on what kind of microbe is in your blood, like bacteremia for bacteria, viremia for viruses, and fungemia for fungi. Okay, that's enough of a tangent on LPS and endotoxins. Back to blood cultures. We like to take the blood culture samples as early as possible, because once we start treating the infection, we might not see enough of the bacteria in the blood to grow them, so we don't know what we're treating. We can also do other tests that we mentioned before, like urine cultures, swabs, and CT scans, looking for the source of the infection. This is important because although the way we treat every infection is pretty similar, each different infection has nuances, such as specific antibiotics and procedures that we need to use to properly treat them. For example, the antibiotics we give for chest infections often don't work as well for bacteria that you find in the urinary tract, genitals, and the gastrointestinal tract, because the bacteria are quite different. Some antibiotics can't cross the strict filter protecting your brain, meaning we need very specific antibiotics to treat brain infections like meningitis. And don't even get me started on antibiotic resistance. The two main bacteria causing skin infections like cellulitis are Streptococcus and Staphylococcus. Strep luckily dies to most penicillin-based antibiotics, but Staph is super tough, so we need special antibiotics like flucloxacillin or vancomycin, because it has special ways to chew up the antibiotics to neutralize them. Antibiotics also don't penetrate well into big abscesses, because it's just a pool of pus. Ugh. So we might need to cut open the abscess or puncture it with a needle to suck out all the pus, so that antibiotics can mop up the rest. In dire cases, we might even need to cut out infected body parts or amputate them to prevent the infection from spreading. So yeah, you can see that a lot of thought goes into how we treat infections. It's not as simple as, chuck some antibiotics in the Barbie. Anyway, I won't go into all of the different antibiotic classes and which to use when, because that's a topic for another day. But what's important to know is that we really need to know what we're dealing with to know how to appropriately deal with it. That said, we can't just wait for hours without doing anything, so we often give what are called broad-spectrum antibiotics to patients as early as possible in the course of the sepsis, while we wait for the test results that can help determine what microbe we're fighting against. Broad-spectrum means that the cocktail of antibiotics we're giving will cover most of the common bacteria that could be causing the sepsis. It's like an indiscriminate artillery strike, instead of a surgical, pinpoint, bunker buster attack, because we don't know where or who the enemy are. Once we know what and where the infection is, we can change gears and focus on it with antibiotics that are specifically good against it. Antibiotics have been a game changer for humanity in our war against infections, and to think that we've only had them for 100-odd years. There are many different kinds of antibiotics, but in general, they work by killing or slowing down the bacteria by blowing them up or messing with their internal mechanisms. By killing a large swath of the offending microorganisms, it gives our immune system a chance to turn the table and win the war. I hope by now it's abundantly clear just how much work goes in saving a life. One of the reasons I love medicine is that we're directly using knowledge, like how bacteria cause infections and how the immune system wrecks the blood vessels in response. So we know how to solve the problem with treatments like fluids and antibiotics. It's like a huge puzzle-solving game where you have a chance to alleviate pain and suffering and even save lives at times. All because you were a huge nerd and studied how the body works and how things can go wrong. And that's what this podcast is all about, helping you understand this complex universe and everything within it so you can better tackle the problems that come your way. On that note, let's wrap up and summarize what we've learned. So, what did we learn today? We learned that microorganisms can cause nasty infections, and our immune system responds with inflammation so it can eat up all the microbes. We learned that sometimes the infection is severe enough or leaks into the bloodstream that the inflammation goes out of control and the immune response starts causing more harm than good. We learned that this is called sepsis, and the inflammation wrecks the lining of blood vessels, causing blood pressure to drop and starve the vital organs. We learned about the signs and symptoms of sepsis and how you might identify a potentially unwell patient. We learned about how we can treat sepsis with fluids, vasopressors, and antibiotics, among many other important treatments. Lastly, we learned that learning is fun and useful. Alright, for today's 2-minute explain, let's talk about how horseshoe crabs save lives. I know, isn't that cool? If you don't know what horseshoe crabs are, look them up on Google. They're somehow super creepy and cute at the same time, like Roombas of the seabed. Anyway, these ancient trilobite-esque arthropods are extremely important in the world of medicine because of their blood. Our blood is red because of the protein that we use to carry oxygen, hemoglobin, uses iron to bind oxygen. And you know what iron does with oxygen? It gets oxidized into rust. That's why red blood cells are red. But horseshoe crabs have a different system for carrying oxygen throughout their body. Instead of hemoglobin, they use something called hemocyanin, which is copper atoms instead of iron. If you've ever done chemistry experiments with copper or seen oxidized copper, such as on rusty pennies and, the freaking Statue of Liberty, then you know that copper produces a green-blue hue when it is oxidized. So hemocyanin, as the name suggests, turns horseshoe crab blood into a beautiful, pastel, milky blue color. It's bizarre, like alien blood. Technically in their body, the blood is sort of a greyish yellow, but when exposed to air, it turns a lovely shade of blue. Kind of like how our venous blood is darker than arterial blood. Anyway, that's just an interesting tidbit. The hemocyanin isn't actually what we're here to talk about in horseshoe crabs. It's another unique component of their blood, amoebocytes, that really intrigue us. These are roving cells in the horseshoe crab's bloodstream that act in a similar way to our white blood cells. They protect them against microbes. Amoebocytes have a special property where they contain large bubbles of clotting factors inside them that can be released when the amoebocytes sense that bacteria might be near. The clotting factors cause the surrounding water to clot up into a kind of gel, which encases the invading microbes, shielding the crab. And turns out, the specific signal that amoebocytes react to happen to be lipopolysaccharides. That's right, it's our old enemy LPS, or endotoxin, relevant again. To recap, LPS is a chemical compound found inside of the capsules that surround many kinds of bacteria. When it is detected in our bloodstream, the immune system launches a full-scale assault on it, sounding every alarm and triggering sepsis. It's also called endotoxin because it's a toxin found inside of bacteria. So if amoebocytes react to endotoxin very specifically, could we use it as a test to detect endotoxin? The answer is a resounding yes. This very useful reaction was discovered by an American medical researcher named Fred Bang in 1956, who realized that this might revolutionize safe medical devices and products. Because endotoxin is so prevalent in different kinds of bacteria, imagine if a vial of medication accidentally was contaminated with some endotoxin. If you inject this drug directly into someone's bloodstream, you'd immediately trigger sepsis. And since you're often injecting medicines into already sick people, this could end up in a disaster. So pharmaceutical companies were already looking hard for a way to test for endotoxin, and turned out horseshoe crabs were hiding the answer in the sea. Nowadays, horseshoe crabs are caught, taken to a facility where blood is harvested from their pericardium, the space surrounding the heart, then released after they've been bloodlet. The blood is then processed to produce something called limulus amoebocyte lysate, or LAL, which has been instrumental in making medications and other medical products safer by ensuring that they're not contaminated with endotoxin for the last 50-odd years. All you need to do is apply the LAL to the container that you're planning on putting medication into, and if it gels up, you know that there's endotoxin in there. Like magic, an all-natural chemical test. But in recent years, there's been more media attention on this practice because, turns out, even though many of these horseshoe crabs are freed after some of their blood is harvested, the practice causes a significant increase in mortality for blood-led crabs, because they're much slower and weaker straight after giving blood. You don't even do the courtesy of offering them a bicky or a lollipop. So it's a slightly controversial area, but it is also undeniable how horseshoe crab blood has saved countless lives by preventing accidental sepsis from medications. Luckily, scientists are developing artificial alternatives such as the recombinant factor C assay, which doesn't involve bleeding a live animal. Unfortunately, it's still significantly more expensive than just using LAL, so it hasn't caught on yet. But hopefully it becomes cheaper and more widely available so that we don't have to rely on bleeding the poor horseshoe crabs. In the meantime, we thank them for their involuntary sacrifice to keep us healthy and well. Well, that's it for today. Thank you for listening to Explain This. I hope you learned something interesting and maybe even useful today. Thank you to Jane one more time for the topic suggestion. Keep those suggestions coming so I can make more relevant episodes for my dear listeners. We'll see you next time. Bye for now. Explain This was written and hosted by me, Jin Kim. If you'd like to suggest a topic or just send a lovely message, you can email me at explainthiscast@gmail.com or follow me on Facebook or Twitter.